Imagine surgery without anesthesia. The thought itself is terrifying. Before anesthesia, procedures were excruciating ordeals. They often led to shock, infection, and even death. Anesthesia changed everything. It allowed doctors to perform complex surgeries. It gave patients a way to heal without unbearable suffering. Anesthesia has revolutionized medicine. It enables intricate brain surgeries. It makes organ transplants possible. It's hard to overstate its importance in healthcare today. Anesthesia's impact extends beyond the operating room. It helps manage chronic pain. It provides relief during childbirth. It's a cornerstone of modern medicine, improving countless lives. Our understanding of anesthesia continues to evolve. New drugs and techniques emerge, but the core purpose remains to alleviate suffering and make medical progress possible. Anesthesia is more than just putting you to sleep. It's a controlled, temporary state. It involves different levels of consciousness. It can mean blocking pain, relaxing muscles, or inducing unconsciousness. Think of it as a spectrum. On one end is local anesthesia, numbing a small area. On the other end is general anesthesia, rendering you completely unaware. Anesthesia works by interrupting nerve signals. These signals travel from your body to your brain. They carry messages of pain, touch, and temperature. Anesthetics disrupt these signals, preventing the brain from registering them. This disruption is temporary and controlled. Anesthesiologists carefully administer the drugs. They monitor the patient's vital signs. This ensures safety and comfort throughout the procedure. There are three main types of anesthesia: local, regional, and general. Each type is carefully chosen based on the specific needs of the patient and the nature of the procedure. Each serves a different purpose and affects the body differently. Understanding these differences is crucial for both medical professionals and patients. Local anesthesia is like numbing a tooth. It's used for small superficial procedures. This type of anesthesia is often used in dental work and minor skin surgeries. The patient remains awake and alert. They can communicate with the medical team throughout the procedure. Think of getting stitches or having a mole removed. These are common scenarios where local anesthesia is applied. Regional anesthesia involves injecting medication near a nerve cluster. This technique is used to block pain in a larger area of the body. This numbs a larger area, such as an arm or leg. It's particularly useful for surgeries on limbs. It's commonly used for childbirth and hand surgery. An epidural during labor is a well-known example of regional anesthesia. Patients may be awake or sedated depending on the procedure. The level of sedation can be adjusted to ensure comfort. General anesthesia is what most people imagine when they think of surgery. It is used to ensure the patient is completely unconscious. It induces a state of controlled unconsciousness. The patient is entirely unaware of the procedure. Patients are completely unaware of the procedure and don't feel any pain. This is crucial for more invasive surgeries. This is used for major operations like heart surgery or joint replacements. These procedures require the patient to be fully unconscious to ensure safety and precision. Section 4. The body under anesthesia, a temporary pause. Anesthesia affects various bodily functions, all under careful monitoring by the anesthesiologist. This ensures that the patient remains stable and safe throughout the procedure. Local anesthesia primarily affects the targeted area, numbing it to prevent any pain during minor procedures. It blocks nerve signals, preventing pain sensation from reaching the brain. The rest of the body functions normally, allowing the patient to remain awake and alert. Regional anesthesia numbs a larger region of the body, such as an entire limb or the lower half of the body. It can temporarily affect muscle movement and sensation, making the area immobile for the duration of the procedure. The effects wear off gradually as the medication is metabolized by the body, restoring normal function. General anesthesia has the most widespread effects, inducing a state of complete unconsciousness. It slows down brain activity, leading to unconsciousness and a lack of awareness. It also relaxes muscles and suppresses reflexes, ensuring the patient remains still. Breathing and heart rate are carefully monitored and supported throughout the procedure to maintain vital functions. The body gradually recovers from anesthesia after the procedure, with vital signs returning to normal. Awareness returns first, followed by sensation and movement, as the effects of the anesthesia wear off. The effects wear off completely within hours, although some grogginess may persist for a short while. Section 5. The Guardians of Sleep. Anesthesiologists at work. Anesthesiologists are highly trained medical doctors. They specialize in pain management and perioperative care. They are essential members of the surgical team. Before surgery, they meet with the patient. They review medical history, allergies, and medications. They discuss the type of anesthesia and answer any questions. During surgery, they administer the anesthesia. They closely monitor the patient's vital signs. They adjust medication as needed. They ensure the patient's safety and comfort throughout the operation. After surgery, they oversee the patient's recovery from anesthesia. They manage any pain or nausea. They provide instructions for post-operative care. Section 6. Safeguarding the patient, safety, and common uses. Anesthesia is generally safe when administered by trained professionals. These experts undergo extensive training to ensure they can handle any situation that may arise. Complications are rare, thanks to advances in technology and monitoring. Modern equipment allows for real-time tracking of vital signs, ensuring any issues are detected immediately. Anesthesiologists use various tools to ensure patient safety. These tools include sophisticated monitoring systems that provide continuous data. They monitor heart rate, blood pressure, and oxygen levels. This constant vigilance helps maintain the patient's stability throughout the procedure. They have immediate access to medications and equipment for any situation. This readiness is crucial for addressing any unexpected complications swiftly. Anesthesia has numerous applications in healthcare. It is not only used in surgeries but also in various diagnostic and therapeutic procedures. It's essential for surgical procedures, from minor to complex. Without anesthesia, many of these procedures would be too painful to perform. It's used for pain management during labor and delivery. Epidurals and other forms of anesthesia help mothers manage pain during childbirth. It helps control chronic pain in some patients. For those suffering from long-term pain conditions, anesthesia can provide significant relief. Understanding anesthesia is crucial for anyone undergoing a medical procedure. Being informed helps patients feel more at ease and prepared. It empowers patients to participate in their care. Knowledge about anesthesia options allows patients to make informed decisions. It fosters trust in the medical team. When patients understand the role of anesthesia, they are more likely to trust their healthcare providers. Anesthesia has revolutionized medicine, making countless procedures possible while minimizing pain and discomfort. Its development continues to enhance patient care and outcome.